Hey, what's up? Dave with Brazos Valley Strength. And I am just wrapping up my second bench press day of the week. I talked about my pec in a previous video in my introduction to my Raw Nationals peaking block video. I've talked about it a little bit on Instagram. And I think that there's been some interest in my rehabilitation process here. I think this is, hopefully, my plan here is to make a good video. I'm skeptical, I'm hesitant, I've been hesitant to make any sort of rehab video because it's certainly not my area of expertise, right? I don't have a formal education in this stuff. I follow some good people who I think put out some really informative content. I also think that there's a lot of really bad people in this area. So my goal in this video is when, my disclaimers here. My goal is to hopefully present some, I'll call it evidence-based information, but that I want people to understand that this is coming from somebody who does not have any sort of formal education in this area. I think right now, people can be very good at these kind of things. I would in no way take on somebody in a rehabilitative setting. As a powerlifting coach, it definitely becomes part of my job that I have to triage a lot of these things. For myself as well as a powerlifting athlete, I have to be good at managing these things. I think that this information hopefully will be practical and useful, but I really don't want to overstate my expertise here. I put a link in the description of this video on a few people, and I deliberately kept it small, my list of people, both some rehab people and some strength people, like just people that post informative content regularly that is easy to digest. Like that was kind of my bar there, but I also didn't want to just overwhelm people with like 100 links. There's a lot of good people that you can follow for good information on this subject. So hopefully this video will be practical. It'll share some of my experiences in this moment. And I think that this rehab, I'll be talking about my pec, is interesting because it's kind of presenting in a way that I haven't really experienced before. And I'm approaching it in a way that I haven't before. But the concepts I think are going to be solid. I wish that I would have started this video a couple of weeks ago. I wish that when my pec first started hurting that I would have done this because I kind of had some of these ideas as far as how I was going to approach it. But, maybe frustration or whatever, or like, some doubts, right? I didn't know that things were going to be going well. Right now, they certainly are. So we'll talk about all of that kind of stuff, hopefully dive into it. By the way, I am planning at some point in bringing on one of these people, the rehab people in the link, to do a sort of podcast episode. On my old channel, my Brazos Valley Barbell channel, I did a sort of podcast with the data-driven strength guys who are also in that sheet, that list of people. And I think that was like one of my most underrated videos. It's such good stuff. And I think that video actually will have a lot of the framework and stuff that I'm going to talk about here. And basically the concept of intraset fatigue is like vital. So I'm going to talk about intraset fatigue. I have another video planned on just training fatigue in general, and intraset fatigue will be a really big part of that. But basically, intraset fatigue is the velocity loss that you get from the first rep to subsequent reps. So velocity loss, if I say velocity loss or intraset fatigue or just fatigue, I'm mostly just gonna be talking about that stuff. I'm specifically talking about changes within a single set. Of course, if I do the barbell, that rep is gonna move faster than what my heaviest single of the day is gonna move. But that to me is not fatigue related. And again, I may say to me more than I should, maybe my lack of education, but I'm gonna try to hedge my bets, I guess, a little bit. So that is not fatigue related, it's load related. And that when I get to my heaviest loads, the weights slow down, but I'm producing maximal force, right? Hopefully, at least when I'm healthy, I'm producing the most force that I possibly can. If I were to do a max effort set of 5, set of 10 or something like that, what we would see is the first rep of those sets moves very quickly, and then later in the set, I'm now struggling and I'm failing. And let's say I fail, a 10 rep max, set of 10 at the end there. That's clearly going to have significant velocity loss relative to the first set. So those sets are going to be very, very fatiguing. So that concept is going to be really big here in the way that I'm approaching this process, especially because I have a competition here at this point in 3 weeks. So to outline, I guess, what's going on. I have struggled with pec issues kind of forever at this point. For the most part, I generally, the left pec is kind of the most common one, but it shows up just with general pain at the bottom when I'm bench pressing and really limits force production. That comes and goes. I've gotten better at managing these things, and I'll come back to kind of the whys within all this. We'll set it up. I've gotten better at managing these things, choosing better accessories, things like that hopefully can progress my bench press, but it really has plagued me for a while. I think I've actually gotten to a pretty good point with it, and then unfortunately I had an elbow thing, and I think actually some of it was me avoiding like more pec exercises, and I started really pushing like overhead press, and I got really strong on bench press, but I beat up my elbows, and it was like, again, it'll fit into the concepts. Like the kind of the why as to why I think I have elbow pain will fit into the whys of why we have pain in the first place. So then I had some elbow pain, and unfortunately that persisted a good bit of this year. And I think, in my opinion, for sure, muscle-related discomfort, like me straining my pec or like even a tear, those things tend to be a little bit easier to manage. They resolve a little bit quicker for most people than some joint kind of pain, tendinopathy kind of stuff. Like, if you have patellar knee pain, that stuff is stubborn and it lasts a long, long time. So I think a lot of everything that I say in this video, I think will be applicable, across different discomforts that you have. But I do want to say that a lot of my successes are in overcoming some of these muscular things, and those tend to recover a good bit faster than what some of the tendinopathies do. So anyway, had that elbow thing. I actually overcame it fairly recently, like within the last 2 or 3 months, and really started being able to bench press again. Feeling really healthy, worked up to like 195 on bench press. Okay, so we're feeling pretty solid. And I got a little bit of pec discomfort there, but okay, I'm pushing bench press harder at this point. I go on vacation, come back, and my pec is kind of achy, but like not really worried about it. And I actually started off the block bench pressing really well, had a lot of pop. Going into my second bench press day of the block, I was really, really struggling to lock out the bar. And I wish I had videos. A lot of these videos I deleted, frustration or whatever. But about halfway up on my reps, and I think some of the videos I'll be able to show you can kind of see it, but it was a lot more dramatic a few weeks ago, that I was really struggling to lock it out. So still definitely feeling like it's pec pain, kind of deep inside, like I really couldn't even palpate where it hurt, but it was certainly in there. So that is different than any sort of pain, pec pain, that I've had historically. Different feeling, most time it's at the bottom. So this one kind of ended up needing a unique approach, that I was really, really struggling to do any rep work, like kind of regardless of load at first, that I could pick up a weight, it would feel pretty good, hit a rep and like, a little bit of discomfort, but every time I would go through the top, I would really end up with more pain. But I found I was able to do very low sets and very low rep sets, and singles were actually pretty accessible to me. And in this moment, especially heading into a competition, that's clearly a good thing. And that it's been unique in that I can still press the bar very hard off my chest. Then I kind of get some, it grabs as I'm going up to the top. So basically I changed my whole program. Going into it, my thought was I'm not going to push too much intensity. I'm going to keep my pecs healthy. I'm going to keep my elbows healthy. I'm going to get a lot of good rep work in. I'm going to feel confident blowing this bar off my chest. Well, then that discomfort came and I can't do reps. So now I've totally rewritten my program, and essentially singles are like almost all that I'm doing. I'm doing 3 days a week of about 5 or 6 singles on those days, and basically taking it as far as I can with those. So I think that maybe brings us to a point that I do want to stop, I guess, and outline why I feel comfortable, despite being in a good bit of pain, that I feel comfortable doing some pretty hard reps right here. So this maybe is going to be the part that I would assume is controversial to some degree with the stuff that I'm going to say, and you know, occasionally I can be argumentative in the comments with people that I disagree with. I'm gonna not on this video for sure, basically because I don't have my own expertise to back it up, you know, and I do plan on bringing on somebody at some point and, you know, having an expert, and maybe I'll argue with them at that point, or argue with the people in the comments at that point. But I think what we need to acknowledge here is all of the evidence on pain, kind of the emerging pain science stuff, basically says that there's not a good correlation between the discomfort that we feel and the tissue health, right? So we can feel a lot of pain and have no damage whatsoever. And the opposite can be true too. I can have a totally shredded muscle or something. You know, people, rotator cuff injuries or like labral tears in the shoulders, things like that are pretty common that we may see. People can look at imaging of these things and see, oh, you had asymptomatic issues in your shoulder. And other people have those issues and have a lot of pain. And, you know, it presents differently from person to person. So I think that concept is really important at first. But that, especially as powerlifters and people who are challenging our training, what we're going to run into is effectively like tolerance of the muscles. That we can exceed the muscles' at least perceived capacity for loading. And I think perceived is an important thought here, because if I do have an injury to the muscle, something like a body weight squat or whatever, right? Like may really, really hurt, but like the muscle can handle it, you know? So the perceived loading of the muscle, and I'm going to frame it mostly around muscles because it's easier, but the perceived muscle of the area of discomfort where we're having that pain. So one of the ways that I try to make people think about this is that the way that we're feeling discomfort is similar to an allergy. That if I'm allergic to peanuts, when I eat peanuts, it's not the peanuts that kill me, it's my body's reaction. It's the perceived threat of the peanuts that at that point kills me. So pain is gonna be a very similar concept in that we can have a lot of discomfort without really any perceived threat. But the way that we approach it is load management. That's a buzzword. I think it's the way to go about this, but I think that it's kind of easily thrown around. Oh, we manage load. But that comes in a lot of ways. And I think it's easy, like I'm gonna make the assertion that there's no such thing as a rehab exercise. And I'm gonna come back to that. But a good example here to where I might potentially contradict myself is, let's say my knee hurts. Because my knee has hurt. But I've had some injuries on my left leg. I've torn my adductor, I guess twice at this point on my left leg. I have like some hip pain, probably associated with all of that. And especially after my original big adductor tear, I got a lot of knee pain on my right side. Well, that makes sense. I was almost certainly shifting away from my left side and shifting into my right side. So when we are talking about load management and that there's no like rehabilitative exercises and then we just want to manage load and reduce it to where we need to, that's the same thing here. But what I'm feeling with my knee is overloading, that I'm putting too much stress on that knee. Rehab exercises or like load management, or specifically rehab exercises, I think is the main point in this case, is not going to fix my knee. What's going to fix my knee on my right side is being able to load my left side more and make that stronger. And so in that way, there may be some rehabilitative stuff that's going to be necessary. But it's all the same concepts, because the issue that's getting me to shift away from my left leg is the guarding, it's my body's reaction, it's fear to putting load on that left leg, so I shift into my right. So then I end up overloading the capacity of the muscles of the joint on that leg. So the way to fix it is gonna be load management, reducing load off my right leg by making my left leg stronger, making me more comfortable, making my squat more confident. So that's been something that I've had to go about for a long time. But it's not always that clear that we absolutely can have discomfort because of the way that we're moving at times. But we also can be moving very weirdly and have no discomfort whatsoever. And do we need to fix the movement at that point? No, probably not. But that's where this whole field gets a little bit complicated. I don't have a good reason why my pec hurt, especially right now. My left pec tends to be the one that gets injured. Maybe I move weird, I don't really know. Maybe it's because my elbow hurt and for whatever reason I moved a little bit weird in that moment. I don't have a good reason. But right now, I can manage doing some bench press, I just can't really do reps. So the way that I'm approaching this rehab is that load management, but with the specific timeline of needing to be able to do a very heavy single in the competition. So treating it like an allergy, I don't think that most people who have a peanut allergy would want to like microdose, but I guess at times that can be a concept, that some graded exposure to that thing may reduce symptoms there, right? I guess if you're a Princess Bride fan, right? That happened in that movie. But it's the same concept with this, that now I'm going into every session when I'm bench pressing and just doing what I can. Now I have a concept at this point, but I'm going into it knowing that I can do singles while I can't really do other stuff. And I'm not planning on pushing volume. And I'm allocating a lot of the total work that I can do to the actual competition lift that I need to do. But I'm making sure that I'm able to repeat that effort very frequently. I went from bench pressing 3 days a week to now I was bench pressing 6, now I'm bench pressing 5. So I'm bench pressing every single day now. But I'm doing that by lowering my fatigue per session, by keeping those sets, by reducing velocity loss in those sets. And that's a big deal. That's where so much of our fatigue is going to come from. I just posted a video fairly recently on this, about kind of where, it was the video on singles, talking about why we can end up doing more singles, and that may be a relevant video. But that now I'm in a position that all of those concepts come in very, very strongly right here. That I have to go after my bench press in a way that prepares me for the competition and reduces pain. I could probably take a pretty conservative approach and do some light tempo reps and probably make steps in the right direction, but I don't really have the timeline for that. I'm lucky in that the way that it's presenting itself is allowing me to do singles. This is a unique situation in that I'm able to actually do the competition lift pretty well and pretty aggressively, and that I'm getting a lot more confident with it. I don't really have fear that there's like structural damage and something's gonna happen, but it's gotten a lot better, and so I can go after the singles. And here is the important concept that my bench press is my rehab here. What I said earlier was that there's no such thing as a rehab exercise. That is an important thing. So when we are talking about load management, we were thinking about the area of the muscle, whatever it is that hurts. That certain muscle, that movement, now has a much lower capacity for loading or force production or whatever. So let's say when I bench press, my pec is hurting a whole lot. Let's say it's different and I can't actually push hard off my chest and it's really hurting at the bottom. And I do have to manage load differently. It may be something that now I go to like a single arm dumbbell bench press and I go real slow, or I can do cable work, or I can do some of these exercises that are more like visually rehab exercises. I think people think that those exercises have some unique quality about them that actually makes them rehab the muscle, or like the stability demands really rehab the muscle, but it does go back to load management in the first place. So if we're thinking that I can't bench press, like I can't bench press over 300 pounds or whatever, there's so much pain. All right, well, what specific movement or what tissue or whatever, what muscle needs to be backed off on? So I can find an appropriate load for those muscles, reduce my training stimulus to where it needs to be, give it the capacity to train, and then start introducing that stimulus in that rehab movement that will allow the gradual loading, right, the load management to pick back up, and the tolerance to that movement to come back around. So the mistake people make would be that, oh, I have knee pain, I'm just gonna keep squatting really hard, but I'm gonna add knee exercises in here that are rehabilitative to my muscle, but we're adding training stress to that knee. That's not what we wanna do. In that case, I might wanna add training load to the other side to be able to pick up the slack and make that leg stronger, and over time I get more confident, I can shift back to that leg. But it's likely in that moment that we need to reduce our total squat volume, our training volume, so that we can get things under control and allow that adaptation to occur. So we can't just add these rehab exercises and just think that there's some magic quality about the rehab exercises themselves that are going to improve our tissue health or our ability to handle loading. But it's going to be reducing it to a level that we now have control over the concept, and then we can build from there. So with my concept right here, I truly feel lucky that it's presenting in the way that it is. I can press hard. I can press hard off my chest. It just hurts a lockout. Fine. So I can approach this going in every day, and right now I'm alternating. I'm doing singles and then some light rep work, and giving myself that exposure to bench press. Today went the best reps have gone. I worked up to 150 for a fairly easy set of 5, so I was able to actually progress things. So at this point, my tissues are starting to get a lot more acclimated to that loading, particularly in the rep work that I've really struggled with. So when we're approaching rehab, we're always looking for what can you do? What exercise feels okay? I can't bench press. Okay, well, can you do dumbbell bench press? Can you incline press? What pressing can you do? Let's start there, right? Let's remove the thing that's very painful right now, and let's start building back in the other stuff. But then we have to challenge it. And we do want to bring back in the specific movement and use that to actually build tolerance as well. So I think that people make too big of mistakes with things. They either like continue to push way too hard and they don't allow the capacity to do it while trying to add in rehab stuff, but those two things don't really mesh necessarily. Or they just cut out everything and they dive back in full force, but the tissues haven't been given a good chance. They feel better because we rested, but then you dive back in and then it hurts again. So we have to give it that ability to build back that tissue tolerance and ultimately reduce its sensitivity to that movement. So I think that is the kind of the overall concept of what I wanted to say with this. This is a really interesting field. I'm glad to have the knowledge that I have to overcome some of the stuff. I say all the time that like one of the biggest reasons that like the really good athletes at the top level are what they are is they're just like better at overcoming these things. It does take a lot of toughness. I actually think that there's research that says that people who actually challenge, who push into a little bit more discomfort than other people actually have better outcomes at these things, which is an interesting concept. Like we don't really want pain, but being able to tolerate a little bit more seems to be a good thing. So as far as my parameters on what I look for with people, generally speaking, a 3 or 4 out of 10. That can be wildly different from person to person, right? Some people are pretty tough. Some people are not tough at all. I think the easiest way to say it is that we're looking for a pain level that doesn't automatically reduce your performance. So if my knee hurts and I'm squatting and I'm shifting away and I'm really limited by that, it might be a good idea to reduce the load a little bit so that I feel like I'm actually moving with better quality, that I feel more comfortable. But if I'm really shifting away from it, that might be a little bit too much pain. Another good way to say it, and I heard this one recently, I think Rob Escalante was the one who told me this, but some people who struggle with that 3 or 4 out of 10 range, what he said that he tells people is that it shouldn't get more than 2 points of pain higher than what it is resting. So if I'm able to like do a bench press, or let's say like a barbell bench press, and I feel X amount of pain, if I do it and I put a little bit more load on it, I still feel it, but it doesn't really get any worse, okay, that's acceptable. But if it gets 2 points higher than that, okay, maybe we want to scale back. But I do think that getting better at a pain rating would definitely be a good thing. Also, it's very normal to have some discomfort the following sessions. I've been lucky, and I think I'm doing a good approach of keeping my fatigue very low. I actually am basically feeling better every single session at this point by a little bit. I haven't had what feels like a setback day with this strategy. But it's normal, under normal circumstances, for you to do some training, your rehab exercise, and feel a little bit worse the next day, right? In the same way that you would be sore from training, it's normal for these muscles to be sore from your rehab work. So that stuff is normal, but I think that the general recommendation there is 24 to 48 hours. We're looking for that pain to return to baseline, not to nothing, but back to the level that it was before the intervention, before the training that you did. So overall, I think that that is the concept here of things. I'm sure people will disagree. Hopefully this gives people tools to approach their own training. And genuinely, I'm not saying that you should go in and be looking for singles. This is a very unique situation. This is like the first time that I've actually had this ability. Almost always it's lighter reps, it's like ascending sets, it's things like that tend to be my strategy to overcome stuff. This is just those concepts presenting in a much, much different way. So normally I'm not saying do singles. It's just the thing that feels the best for me. It's the thing that I have access to right now, which is great heading into a meet. So if you did like this video, give me a thumbs up, subscribe to the channel, and we'll see you next time.